Friends, it's Dr. Cameron Rockstar here. We're going to talk about the non-surgical nose job today. And a very common question I often get from my patients is, what is the best filler for the nose, for my non-surgical nose job? As you know, the non-surgical nose job has been around in my hands for almost 20 years. Discussed the procedure many times on various shows, Good Morning America, Today's Show. And today I wanted to take a more in-depth look at all the fillers that we have and really what is the best filler for a liquid nose job or a non-surgical nose job or nose fillers in general. You know, in the past 15 years, our access to fillers has grown in the United States as many new fillers have become FDA approved. And so that actually gives us a lot of choices to pick the right filler for the right nose. So the real answer to that question is, what is the best filler for a non-surgical nose job? Really depends on the person that we're treating, and also it depends on what kind of nose we're trying to correct, what kind of asymmetry we're trying to correct. So I oftentimes use a filler called Velar. And so Velar is a very nice filler. It's been around for years now. And the reason I like this filler for many noses is several-fold. One is that the FDA is actually allowed for the filler to claim that it lasts for up to 18 months. The second reason I like this filler Velar a lot, because it gives you very little swelling compared to most fillers. So the swelling is minimal. So I like to use this filler oftentimes to raise the tip, or get rid of a hook nose, or a bump on the nose. Sometimes I need a thicker filler I like to use. So one of the thickest fillers we have out there is Radiesse. Now, as you can see, Radiesse is a different color. It's white. Radiesse is made up of calcium hydroxyapatite. It's a very thick filler. This filler I like for noses when I'm trying to create more of a bridge. So I like this filler for Asian noses. I like this filler for African American noses when we're trying to actually create a bridge to give rigidity to the nose. It's a really nice filler. Sometimes I use a finer filler. I use a filler for Restylane, called the Restylane. Restalane's been around for 20 years, probably the first filler, hyaluronic acid filler, FDA approved. And I like this for subtle work. Sometimes I use this to change noses when people have sideways deviations. They have asymmetries created by a surgical rhinoplasty. If a surgical rhinoplasty hasn't gone perfectly, this is a great filler for that. A heavier version of this is Restylane Lift. I also like this, very similar to Restylane, when we need more bulkiness. Couple of fillers, in my opinion, to avoid. All right, Bellatero. Bellatero is good for fine jobs, but Bellatero is not a good filler for the non-surgical nose job. All right, it doesn't last that long. It lasts only 3 or 4 months. It doesn't have numbing inside of it, so it hurts more. I would avoid this filler. Voluma, a thick filler they have. This is a great filler for cheeks. I don't love it in the nose because sometimes it gives you too much volume and the nose looks too bulky. And we want rigidity, we want fineness of the nose. This is not the right filler. Juvederm also is a good filler, but you have to be careful. This filler is good when you are looking for a lot of volume, but you're looking for diffuse volume, not for volume that's concentrated and rigid in one area. For example, I wouldn't use this filler if you're trying to narrow the nose. So as you can see, we have a lot of choices. The idea for you to get the perfect result for your non-surgical nose job is obviously to see a doctor who's very experienced in doing this. Choose the right filler for the kind of nose that you have, that you're trying to fix. As I said, this filler, I'm actually going to show you Radiesse. The reason I like it, it's very thick, but you could see Radiesse is very much like a toothpaste. So this gives you a lot of rigidity. It's good to create noses. It's good to create lines in the nose. As you can see, it's like toothpaste. Extremely thick, all right? So this would give you a different result than a filler like Velar, which is finer. It's more for fine work. This is a hyaluronic acid filler. As you can see, this filler is a gel-like substance. It's much softer. It's a gel as opposed to being rigid like Radiesse is. All right, so I hope that you guys got a nice understanding of kind of the different fillers we have available in the United States, and the choices that you have, and also to make sure to use a doctor that really has an understanding of the different fillers for different types of asymmetries that you're trying to correct. There's also 2 other fillers that you should really be careful about, and you should really almost avoid. The filler that I would avoid at all costs personally in the nose, in my opinion, is silicone. Silicone is extremely dangerous in the nose because silicone grows with time. The result that you get in a year or two is not the same result you get in 10 to 20 years. Silicone is a permanent filler. It's an inert substance. It doesn't get metabolized by our body. It always sits there and the body walls it off and it grows. So be very, very careful about using silicone in your nose. I don't recommend it. The second filler you should be very careful about is a filler called Bellafill. Bellafill is made up of methyl methacrylate. These are tiny little plastic balls. It's the only filler in the United States where you actually need to do skin testing to make sure you're not allergic to it, because you can have delayed allergic reaction to it. Also, polymethyl methacrylate or Bellafill, it's a semi-permanent filler. So if you don't like it, you're in trouble. You can't dissolve it. Be extremely careful. If you do it, you must use an extremely experienced doctor with that filler. Dr. Cameron Rockstar signing off now.